What I'm going to go through right now are the top 3 exercises you can be doing right now if you think you're dealing with a disc herniation. So the first one we're going to go through today is a prone press up or a McKenzie maneuver. If you guys have tried that in physical therapy in the past, great go-to exercise to at least alleviating the symptoms, but particularly when we're looking at having symptoms that are running down the leg and making them want to suck back up towards the spine. So the setup and getting into this exercise, pretty straightforward. I actually have Savannah do this for us. She's going to go on her stomach. And this is what you'll do, be flat on the stomach. We'll keep the hands actually just about at shoulder level here. And what we're going to do is making sure that we're keeping the muscles of the back, glutes, and thighs as relaxed as possible. Taking a nice breath in, and then on breathing out, we're going to press up high, like into a push-up position, putting a nice bend right on the low back here. By doing so, that actually clears more space so that nerve is not getting pinched on by that disc. So what we'll do is we'll come up, cycle breath, and then we'll come right back down to the table. And that's how I like running these, is you just take a breath in and press up, and then at the top we'll exhale, okay? And we can cycle that breath up and down, going anywhere from 10 to 15 repetitions with that. Now, what I'll have Savannah do is go ahead and sit on up for me here, or actually go up on your back, and we're gonna go through something called a pelvic tilt. Okay, basically doing the press up but in reverse on our stomach. Very small, minute movement to be going through here, but all I'm gonna have Savannah do is she's just gonna tighten up the back core, rotate her hips underneath, like she's bringing her belt buckle up towards the sky. Okay, nice. Cut. The second exercise is a pelvic tilt. A very small, minute type movement, but a great way to actually get some control back in that low back and still work on easing those symptoms up a little bit. And so, very simply, what I'll have Savannah do is you can tell she's laying on her back, but we can actually go ahead and bend the knees up too. Okay? And all we're going to focus on doing is 2 things. One, being able to smash that low back flat into the floor. And then the other thing is rolling the pelvis up this way. So very tiny movement. That's all it is right there. And so we can use the breath as well, but we're going to smash the low back in, roll the pelvis up, and then controlled uncork it through there. Okay? Now, third, last exercise we're going to do is Savannah, you can come on, sit on up here, facing this way. And what a great way to directly get after the nerve is a nerve glide. So very simple movement. I'll show this to you and then you can perform it too. But 2 ways to do this. With the nerve glide itself, remember that these nerves are on their way out of the spine. They're going right in between these muscle bellies. So they're meant to swish back and forth. But if we're having a disc herniation going on, what's going to happen? It's going to want to guard. That nerve does not want to be touched. It wants to stay put, so it'll make the muscles around it go squeeze really tight.